Okay. Yeah, welcome everyone to our fifth and our final session of our Iowa Next Gen Sector Partnership webinar series. We've gone through quite a wide range of topics and kind of that journey from planning to launch to longer term sustainability over the last 5 weeks. So I appreciate everyone taking time out of their busy schedules to be part of that conversation. A quick reminder that the recordings of all of the previous sessions are on the main website for our sector partnerships at sectorpartnerships.educateiowa.gov. It's also on, if you just go to YouTube and just Google Iowa Sector Partnerships, or if you just Google, I think, Iowa Sector Partnerships in general, they'll probably come up because they're so new. But we're happy to have those recordings available for any of your staff or colleagues or sector partnership members or employers, those who were not able to join, and maybe just to send them as kind of a refresher in the future. So definitely check those out for future reference. We're still in conversations about what we're going to do next steps with this project. So I'll give a little bit more details at the end of the conversation. But like I said, I want to keep a lot of time open for some conversation with Yvonne and Lynn and Emily, as well as leave some open for just direct Q&A for any topics that are still out there, burning questions, things we haven't covered, or maybe something came up on a previous webinar that you've been kind of holding on to in your back pocket that we want to roll out there. So really excited to have that type of a discussion and conversation today with our national sector partnership consultants from the Next Gen Sector Partnership team. So more info to come at the end. I've got a couple of exciting announcements to make, but I'll turn it back over to Emily for our discussion here. Thank you.
Thank you, Joe, and welcome everyone. And I'm going to ask everyone to mute themselves here as we dive in. I was hearing a little bit of background noise there. It's a pleasure to be here with you all again this week for the fifth and final in the webinar series. This week we'll cover the business perspective and really have ample time for questions and answers and just in conversation with you all around Next Gen Sector Partnerships and what you're sitting with as you're grappling with how to really move forward with next steps around Next Gen Sector Partnerships in your communities. So as you all know, and welcome to new folks that are on the phone, I am Emily Lesh, and I work as a part of the Next Gen Sector Partnership team and have prior experience working in Colorado as the Assistant Director of the Colorado Workforce Development Board there. And so for the last 3 years, have been working with next generation sector partnerships across the country. And so today my role will be to move the conversation forward and also just lend ideas and expertise in what we see work well and what I've seen work well in partnerships across the country. I'm really excited to have Yvonne Meyers and Lynne Vossler with us again today. So Yvonne, I am going to have you introduce yourself.
Okay. Yvonne Meyers. I work at Columbine Health Systems. We're a long-term care organization here in Northern Colorado. I've been here 29 years. I've been a part of our sector partnership since 2013.
Thank you, Yvonne. And Lynn.
Yeah, so welcome everyone. Lynne Vossler, Director of Workforce Solutions for Front Range Community College. We are a college in North Colorado with 4 campuses, 30,000 students, and I helped start the NOCO Health Sector Partnership and the Manufacturing Partnership, and I'm working on a Boulder Broomfield IT partnership and then helping some other partnerships get started in Wyoming.
Excellent. Thank you, Yvonne and Lynn. And it's really great to have you both here today. And I think you all as participants will gain a really interesting perspective as Yvonne is a business champion with the NOCO Healthcare Sector Partnership, as she said, and some interesting perspective around how she and Lynn, as a community support partner, our public partner from Front Range Community College, have really worked together over the last, let's see, Yvonne, how long has it been now? 7, 8 years since you launched the healthcare partnership?
A little bit over 6.
A little over 6. Okay, I was moving a little too fast there. Great. And I see that we have new folks that are chiming in here and joining. So welcome everyone, and please do introduce yourselves using the chat box. If you could introduce yourself using your name, organization, and the partnership that you are a part of. Today we're going to, after we get through introductions here, we are going to do just very quick breakout rooms again for about 5 minutes for you all to just chat with one another in breakout rooms and introduce yourselves. And then we will also, and then following that, we're going to dive in to the business perspective that Yvonne will be sharing around and tips to look out for. And then also just some final tips and what to watch out for and some pitfalls to watch out for as you move forward with the next gen approach in your communities. So I would love to, I'd love to just dig into introductions and who we have on the phone. We do have a smaller group today, about 20. So I think I actually, instead of opening up the breakout rooms, we'll just keep the conversation here. So I'd love to have you all just introduce yourselves here on the chat. I see many introducing yourselves here. Christy from the Northwest Iowa Manufacturing Partnership, Mandy, the chair of the Eastern Iowa Advanced Manufacturing Sector Board. So I would love to just hear from you all and just conversation here quickly. If you could introduce yourself and who you're with and any ahas that you've had around the next gen sector partnership model, or any questions that you are still sitting with or even skeptical about. So let's just dive into a conversation here. Who would like to kick us off and introduce yourself and ahas or questions you have? And you can unmute yourselves here as you introduce yourselves.
Okay. This is Christy Heisinger with Northwest Iowa Manufacturing Sector Partnership. One question I still am wondering about is around metrics. How to define and measure them. So I've tried to brainstorm on this a little myself, but I wasn't coming up with something that was practical to collect data on. So that's something I'm looking for. Excellent.
Thank you, Christy. Let's hear from others, and I will be sure that we come back to that, Christy, in the conversation here. And I'd love to hear directly from Yvonne and Lynne around metrics and how they're defining and measuring metrics practically in the healthcare partnership, and Lynne, other experiences you have. But we'll come back to that. Thank you. How about others? A good number that are introducing yourselves here on the chat box. Allie, Shannon, Mandy, Becky, Gary, are there questions that stand out to you? And also would just love to hear folks' voices. Don't forget to unmute yourself here as you're speaking.
This is Shannon. Can you hear me?
I can. Thanks, Shannon, for diving in.
Yeah. So we are an organization that is not currently involved in sector partnerships. So I want to say thanks to everybody that's been open and welcoming to helping kind of give us advice and learning about some pitfalls so we can be prepared as we potentially enter into some of these. So.
Excellent. Thanks, Shannon. And who are you with again?
I'm with the Decatur County Development Corporation in Southern Iowa.
Excellent. Okay, great. Well, thanks
Happy
for
to have
joining.
you, Shannon.
Thanks, Joe.
Great. How about others?
This is Becky Hassett from Iowa Valley, and I'm new to, I guess, being a part of the sector. I've attended the meetings in the past as a partner, but now I'm in a new role and I'll be able to help facilitate those conversations. So I guess I'm ready to get started. Any advice on bringing in new businesses?
Excellent. Okay, new businesses. We'll be sure to hit on.
Sorry, this is
Yeah,
Mandy Parcher. I'd say to elaborate on that, ours is how to continue to engage those that we have and keep the momentum.
Great.
You know, I'm curious, I see some friends from the Sioux City area, and that's, I know I've spoken with some people from Western Iowa Tech, the local community college, about sector boards or sector partnerships. I'm curious if you've heard any other news from them, or if from the Iowa Works side, if you have any updates or thoughts on taking a dip into this world.
I guess I'll speak since you're calling me out there, Joe. I would say I am more than willing to dip into this area. I have not really heard much from any conversation that you would have had with Western Iowa Tech. So knowing that you've had that, I can follow up. I think, you know, we're a part of a lot of different groups, and really the struggle is getting businesses, you know, to the table that will really take the lead on this and not view it as, you know, another meeting that we're trying to hold. Which I think is common. But I do think there is potential, you know, if we can find the right people who, you know, want to be engaged and move this process forward.
Great. Yeah, and I'm happy to have that conversation or anything that I can do to help, absolutely. So happy to have your group on as well.
Excellent. Well, thank you all. And I see Allie chiming in here. She doesn't have a great mic. And so she has questions around, last year, I think she attended or participated in her she's worked with sector partnerships over the last year, attended the healthcare manufacturing partnership meetings. And she has questions around having partners sit in the back and industry in the front to run the meeting. And asking questions around if it's good to present the opportunities that intermediaries can assist with. And it was noted that industry should come up with the ideas on how to help their initiative, and the partners are supposed to be more in the support. And so Allie, I think if I'm understanding here, and you can respond on the chat box, the question is really around should you as a partner from workforce education or economic development really be presenting opportunities to business leaders that you as intermediaries or community partner intermediaries can help with. I just want to make sure that I'm understanding the language, because sometimes intermediaries can mean different things. Okay, so that is the question. Great, excellent. So we'll get into that. And I think this is a great question also, and many of these questions around business engagement, keeping businesses truly engaged for the long haul and not just being another meeting that they participate in, is an important question as we're diving in here and moving forward. And so we have covered the foundationals of next gen sector partnerships over these 5 weeks. And so those being that there is a step-by-step process, a disciplined process to launching and sustaining next-gen partnerships. And much of what we have talked about is that the early steps around building a regional sector support team, preparing to launch, identifying those business champions to make that business-to-business ask, and then hosting the launch meeting and moving into action really are the foundation to building a strong partnership and also to long-term business engagement. And so with that, I do encourage you all to look at the training manual that's on the Next Gen Sector Partnership website. And a big key to sustaining and evolving over time, which we talked about last week, is not just laying the foundation, but continually working to build out your regional sector support team, and also continually working to build out business engagement. And the two really go hand in hand. You need a strong and a diverse regional sector support team to continually attract and build relationships with new business leaders, and also keep the business leaders that you do have involved. and you also need strong business leaders to keep the partnership moving forward overall. And so with that, I would love to hear Yvonne. I'd love to pull you in here and ask you to first just give an overview from your perspective around these 5 steps and the step-by-step process, and provide a high-level overview of the overall life cycle of the Northern Colorado Healthcare Partnership and how these steps have helped you get to where you are today.
Sure, I'd be glad to do that. When our state decided to embrace this, just like you're doing in Iowa, they had a 2-day conference near Denver, and we went and spent time with, Emily and Lindsay and all the folks from what is now Next Gen. And it seemed like what made sense about this model is that it was based on economic information that said, who are your sectors, who is driving your economy, who are those main places that the state should focus in on, and that was really honoring business as well. It was telling us as business people, the healthcare sector is important to our state, manufacturing is important, retail, whatever it is that data showed. And then they said to us, we have this model, and so maybe because I'm a type A, I don't know, but our group was 2 regions, Larimer and Weld, which is divided by an interstate, and for many years that interstate made it a left side and a right side, and that's how it was. And the state was saying, well, we want you to play together, so that was a bit interesting for us, and more so, I think, for our public partners than the businesses, because our employees live across the highway and work across the highway, and we were like, great, we finally get to have one meeting with both sides together. And I tell this often, but it was an overnight event, and I had tickets to the Colorado State University Air Force basketball game, so I drove back to Fort Collins and watched the game. And when I came back, they said, we want you to head up the launch. And because I work in nursing homes, I'm the least scary for people because I hope they never have to deal with me at all, right? And so we have 2 hospital organizations that are very tight and competing with each other and had billboards on the highway, and so it seemed like a nursing home girl could sort of pull that together. And I will tell you that we went to a training on how to do the launch, and we did it exactly by the book. We had a purple wall. We had the U-shaped table. We put the business at the start of the table. We had all of our public partners and friends behind that table. And at one point, when we developed our letter, we had a convener team of people interested, and that convener team was business and all of our partners that wanted to play. We had economic development, we had Lynne Vossler, we had Colorado State University, we had the workforce system, we had chamber, as well as 3 or 4 businesses. And we wrote the letter, then we went individually, and I went and spoke to all the CEOs of the hospitals and said, the governor's brought this to the state, these are all the government entities, workforce system, economic development, higher ed, all of that is involved in this. They've done economic data. I showed them the data. I said, you are an economic driver in our state, and they want you to come to this meeting. And they all came. And I will tell you that a previous county commissioner who now works for economic development at our Colorado State University sat at the U-shaped table. And everyone was like, oh no, the public partner's sitting at the table, what are we going to do? And so I approached her and said, actually, today you're listening and we're letting all the businesses speak. And she actually looked at me and said, well, then why am I here? And I said, well, you're very, very important to listen today. And I will tell you that the businesses in the room were at first, both hospitals were on either side of the U. I was trying to rotate between them. A couple of them said they're trying to steal our ideas. They want to steal our secrets. And I kept saying, no, we don't. We're not interested in that. And we had, Lynn was a facilitator and a major staff member from the chamber, so we tried to make it very neutral. And the question was, what keeps you up at night? Please write it on the cards and put it on the board. And when we were done, 90 minutes later, we had 4 different initiatives that we thought we could do that they all agreed on. And I went back to those CEOs of the hospitals and other healthcare providers, and they said, I've never been in a meeting where we came up with a plan in 90 minutes. I can't believe other people have the same problems that I have. I think this is going to be something that makes sense. And so we met 2 more times as the business group with our partners listening, and they were patient. They were like, we want to talk. We want to tell you what we have. We want to tell you the grants and the programs. We want to tell you what we did in 1972 that really worked that we could do again. And we were like, don't listen. We can't listen to you yet. We have to be sure that we have all the healthcare people that want to come. Everybody has their voice. And after our 3rd meeting, we confirmed the 4 things we wanted to work on. We launched in June. This is now October. We said we won't meet over the holidays because healthcare doesn't meet over the holidays. We have stuff to do. And then we met mid-January. And from then, it has been an equal partnership of the business partners with the private partners, with all the people that want to participate and play. But always making sure that what the business needs to drive the economy to move forward is the main voice and the main driver of what happens with all the business partners. But there are times when the business partners step up, or the private partners, sorry, I get all the language mixed up, but the private partners will say, well, we've got this program we can do, and all the healthcare businesses go, whoa, what is that about, and how will that help us, and what can we do? And pretty soon it becomes, we forget we had the U-shaped table and we had people listening. We just forget. But I can't not reinforce. These folks from Next Gen have launched it across the country. Do exactly what they tell you. It'll make it so much easier. And don't question it because they know. Is that helpful? Is that what you wanted to know?
That is, yeah, that's super helpful, Yvonne. And there are a few key themes that I want to just pull out there. So one was just the power of initially getting the businesses in the room and identifying the same problems. And you had this realization of oh, we are all tackling these things. And so from there was this likeness that you could unite around and gel as a team around, as a team of healthcare leaders in the region. And it sounds like that was a really key pivot point for the partnership overall, and has carried you through to where you are today.
Oh, I remember that, and I remember that director of a very large mental health program in Weld County actually said at that first launch, I've never been at a meeting where mental health and behavioral health needs were listed in the top 5 of anything. He was almost in tears. Right? Because everybody in healthcare is dealing with mental health issues, and he walked away going, I can't believe that. It was pretty powerful. It's really powerful.
And what he was finding is likeness with other healthcare providers, and that they are interested in what he is so focused on.
Exactly. And so that it all melted away that they're going to steal my ideas, or, we're going to lose an edge, or they're going to take our edge. It was all about, oh my gosh, we're all awake at midnight with the same problems.
So now that competitiveness and the kind of the turf that has melted away, I would love to hear about what some of the key accomplishments are and the biggest accomplishments are that you're most proud of, Yvonne.
Well, so one of the big conversations in that first launch, it is a little daunting to think about, okay, you got the U-shaped table, you got everybody there, and then it's like, you need some quick wins. You need some, low-hanging fruit that you can grab and do something about, so that people are like, oh, okay, they heard us, they can get stuff done. This is something I'm going to spend my time on. I'm going to look at my calendar, and I'm always going to book this group into my calendar. And so one of the things that was identified early on at that point was the cultural competency of employees and being ready to, be a healthcare worker and manage all the different sorts of diversity of patients and healthcare users, but then also being more diverse in our workforce. And so Kaiser Permanente was, at our group, and a representative from them said, oh, well, Kaiser's put this whole video program together around diversity, and we would be glad to share that. Our requirements would be that you could commit an employee to an 8-hour training and that you promise to use the materials. And so we had our launch in June, and in August, there was an 8-hour training and videos, and people went, and I'm not kidding you, we lived off of that for about 6 or 8 months going, look what we did, look how great we are, we did this diversity training, we heard what you said, and we got it done. And that was invaluable, and we still owe Kaiser, you know, a big thank you for helping us with that. You know, I think two things that step into mind, and one is that in our region, and it's probably similar in Iowa too, all of a sudden there's a great need for medical assistance. And back in 14, 15, you know, doctors needed to be extended, medical clinics needed MAs, and we had various different training programs. Front Range did, Lynn's organization and others, and diversity of what was the training curriculum. It was often a long program, longer than becoming a certified nurse's aide, and so in 3 weeks you're a CNA and you make a certain salary. You can go to MA program for a year or two and make almost the same salary, a little bit more. Seemed incongruent. And so, you know, if a hospital or a clinic says I need MAs, Columbine Health Systems, we say we need MAs, well, yeah, we need 5 and somebody else needs 7. But when we could pull everyone together from 2 counties and say, what does the MA need? Because we all sat down together, and I think, Emily, you were at that meeting, what's our greatest need? And it was medical assistance. Then you start getting to the numbers of 200 and 300 people. Well, then the community college system stepped up and said, whoa, let's have a meeting and talk about this. And actually, Lynn can give you more specific details about it. But quickly, curriculum changed, length of programs changed. You know, we were able to start producing more MAs. Apprenticeships of MAs have started to happen. We, as a sector partnership, are scholarshiping MAs. We give dollars to Front Range's Foundation and Ames Community College's Foundation around this need for MAs. And all of a sudden, you know, there's still a need, but it isn't this fierce, great, scary. It got taken care of. And again, the power of the group, the power of a lot of voices and a lot of people. And then the other one is PassR, which is the pre-admission screening resident review and health putting a focus on to the people rooms, elderly individuals sitting in emergency rooms not admitted to the hospital, waiting for the PassR, sometimes 5 and 6 days. I mean, it was crazy, 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 crazy. So as I reached out to the Colorado Hospital Association, the Colorado Healthcare Association, the Colorado Department of Public Health and Environment, I said, this is coming from the Northern Colorado Health Sector Partnership. I had everybody's logo. I had all like 50 different names of people. And I remember one of the men from CDPHE looked at me and he goes, who are you with again? And I handed him all those names and all those logos and I said, all these people in Northern Colorado find this a problem. And he said, well, then I better do something about it. And if I would have gone there by myself, he would have said, well, aren't you sweet? Thank you very much. And off he would have gone. And so we asked for it to be an electronic environment. September 1, it starts in an electronic environment. Northern Colorado has offered a training place they only do 4 PassR trainings a year. We got on that list of one of them. The Northern Colorado Sector Partnership hosts that. With the electronic environment, they actually we are the host site for the entire state's training on September 3rd. And the site that we have can hold 500 people. And I don't know how we're going to get lunch for 500 because we usually provide lunch. But at one point now, we're like the place for what's happening in the state for PassR. And so, again, without our group, without the collective wisdom and need, and then the collective rallying around together, we couldn't move that program. We could not make it different, and it was actually impacting the economy. People sitting in a hospital where they shouldn't be, hospitals not being able to discharge people, nursing homes not being able to admit people. It's an economic problem. It's a healthcare problem. It's a safety problem for older adults. So, you know, I've never been able to move the dial on PassR. I've been doing long-term care work for 36 years, and without the sector partnership, it wouldn't have happened. So those are a big win for us. I'm sure Lynn has other opportunities in the workforce committee and things that she does with our partnership as well.
I would add in, Yvonne, the behavioral health issue here is large as well as it is across the nation. And we have one committee just focused on behavioral health. And the things that that group has done by coalescing all the behavioral health organizations in this area is amazing too. They're really starting to bring attention to the need around behavioral health here.
Yes, I would agree. That's a great one to lift up too.
Yvonne, I have a quick question about your training example through Kaiser. I've heard this from other groups across the U.S. where that's one of the incentives, kind of as a financial perspective, that they'll pool resources or they'll go to a training provider and say, we've got 20 hospitals lined up. What kind of deal can you give us as a group? Did that come out of the Kaiser training, or did Kaiser do it for free and it was just a benefit to the members? Or could you kind of elaborate a little bit more on that?
Yeah, so we honestly thought they would charge us, and they did it for free. Yeah.
Because they're a member of the NOCO Healthcare Partnership, right?
Yes.
They are, and that's one of their that was one of their goals in the cultural competency training, was that they would provide it for free, and that you then, even as the college, as we took it forward, that we would provide it for free to anybody that needed it.
Yep.
Wow. Well, I certainly, it's great to just hear all of these accomplishments back to back, and certainly there's several of them where I do just get the chills thinking about the impact that it's having on healthcare providers and the community. The one thing that really stands out, Yvonne, and you're talking about what you've accomplished, is just the power of numbers, and being able to really coordinate together as a healthcare industry, and the weight that has brought to your voice as a collective, and how you've been able to use that to really move things and push change that's needed for the industry and also for community members. I would love to actually now turn to Christy, come back to your question that you had earlier around metrics. And so with these accomplishments throughout them, Lynn, you just hit on the fact that one of the goals of the behavioral health issue and also the diversity training is to provide the training for free. Can Yvonne, you and Lynn speak to how you track your success over time and how you measure the accomplishments that you have had? And I was going to just I was just going to quickly add in there. So how you've measured success, and then I think the important piece to measuring success is not just keeping track and having a list where you note these things, but also telling your story and how you've been able to track success, tell your story, and what that's gotten you.
So I'll jump in real quick and then let Yvonne add in. One of the things that we found is as we get funding through grants, through the state grants and the city grants, to apply for those grants, of course, we have to put our goals down and what we want to accomplish, and then we have to every quarter report back. And those folks are looking for metrics. They're looking for numbers of people that we've included in our career exploration events. They're looking for numbers of folks that we've helped with scholarships. So I think that's one of the ways that we've set our metrics is as we apply for those grants. It's helped us to look at what do we want to accomplish for this next year and what are we going to need to report on as we go.
I'm curious about, yeah. Go ahead, Yvonne.
I would just add, I think that we didn't start with, we have a goal and we're going to do 17 of these and we have to report it back. And I think a part of that was because from the business perspective, we already have so many things in healthcare that we have to report and answer to and do all of that. And I know for me personally, it was like, oh, one more place we have to do, constant data collection from the beginning. And the Colorado Workforce Development Council and the supporters of us would send out questionnaires. How are you doing? Did you hire more people? Did you feel like healthcare was better supported? And we gave that information. And now as we've been able to do projects, like Lynn said, we're able to say we scholarshiped, 5 medical assistants. We offered, 27 trainings on mental health first aid, and these were the average attendance. And we offered, we gave out this many books and supplies on mental health first aid, and we've held this many meetings. And so, I think if you're in it from the business perspective only to see a measurable ROI, you're missing the point. And the point is, what are the things that we can do collectively together to move our sector forward and make things easier and better, and the ROI will come after that. Does that make sense?
Actually, kind of a question that I had, Yvonne. I know some groups have talked about qualitative measures, and I didn't know if that had come up. And just for examples, maybe the members feel a stronger sense of community, or the employers are happy that they now have a network of trusted peers they can bounce ideas off of outside of the meetings. I mean, are there other aspects that you feel groups should focus on or celebrate, or try to kind of, percolate out of that conversation?
Oh, for sure. I think, when we first started, we, we had meetings with big topics. Here are the committees we're working on. We gave lots of committee reports, and we would give time at our quarterly meetings, our 90-minute meetings, our 7:30 to 9 meetings for the committees to meet, because we were still new. We couldn't get people to 2 meetings. Do you know what I mean? They were like, I don't know what we're doing here, what's happening. So in the beginning, our quarterly meetings were what was happening. And then pretty soon the committees grew, they started to get purpose, they started to get some structure, and then we have people that only go to the workforce committee meeting because that's what serves their purpose. They don't go to the quarterly meeting that we have big topics. So now our quarterly meetings, like we have one coming up August 28th, and it's we're finding our hospitals here are skittish and scared about having high school internships and high school shadow experiences and anybody under the age of 18. And it's been going on in Denver for 10 years. So we have hospital folks coming up from Denver. And again, they're willing to come up, drive up early in the morning to be at our meeting to share with us, because they're going to speak to 70 or 80 of us up here about that topic. We don't have time anymore for the committee meetings because we're bringing big conversations that are happening. I will tell you that the meeting ends at 9, and at 9:40, there are still people standing around talking to each other. It's that connectedness. It's like, oh, I haven't seen you, or oh, you're the new person at that agency, or I've been trying to get a hold of you, or let's meet after we see each other at the sector partnership and make those connections. And so, there's a lot of that is difficult to measure. I will tell you that, we have a website, we have things that we try to do on that website, and the city manager from Greeley, who sits in the middle of our Weld County area, he has a really good friend, confidant, he's called Coach Bob, who goes out and kind of makes sure Greeley is being at the places they need to be, what's happening outside and all that. So Coach Bob came to our meeting. The next thing you know, we get a call from the city manager's office of Greeley. Can you come and meet with us? We go and meet with him, and he says, all I hear about is the need for firemen, the need for healthcare workers. He said, I'm going to give you $5,000. I'm going to write you into my budget. You have to give a little quarterly report, keep us in the loop, have a couple meetings a year in my city. I'll start playing with you. What the heck, right? I mean, he reached out to us because we've become an entity now. We're a place, right? And so those are immeasurable. It's hard to capture that. Our city worked on talent, had a consultant come and do a talent assessment, found out all this information, we're underemployed, overemployed, blah, 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 all the things that communities have. And then a group of people, and Lynn's a part of that as well, said, well, okay, we have this report, what should we be doing about it? So they brought the consultant back out, Talent 2.0, and they interviewed the manufacturing sector partnership, they interviewed the health sector partnership. We're written in that report, like they have a workforce committee, they're doing their workforce work. We don't have to mess around with that. our Northern Colorado Legislative Alliance formed a healthcare committee. Workforce always comes up in healthcare as an important thing. So workforce was listed. Those of us on that little healthcare committee said, oh, wait. The Northern Colorado Health Sector Partnership has a workforce committee. Let's have them come and present. So Lynne and others came, presented to that group. That group said, we don't have to go into that space. The sector partnerships is taking care of that. From a business perspective, I don't want to go to 5 workforce committee meetings. I don't want to have 5 different entities working on this. I want a large group of people representing our region working on this stuff. And so, you know, a big measurable that's hard to put into a report is that workforce committee is becoming the healthcare workforce committee in our region. And when people say, I need workforce issues, I'm like, I have workforce issues, I'm like, here's the committee, this is where you meet, let me get you on the list. And that's hard to put down in a report. So that's it. I appreciate the question.
Yvonne, I love the example of Coach Bob and the traction that the partnership has gained as this really go-to spot. And that's really highlighted across the answers and across the board. And in those things, and part of what I'm picking up on from what you're saying, and I'd love to just hear more about this, is that as a business leader in the region, there are a lot of these things that are really hard to measure, but the value to you as a business leader is really immeasurable. And as you're working with public partners across the region, there are these grants and different funding sources that you've been able to attract as a result of gaining traction in your communities. And they require metrics sometimes, but I think part of what you're saying here is that those metrics don't begin to represent the whole of what you've accomplished as a partnership. And this work really requires a mindset shift away from grant metrics to really thinking about holistically how working together collaboratively is moving the region forward.
Absolutely, and our local workforce system has brought to us skillful, way to list jobs and how you interview people and how you look at their skills versus a certain set of criteria that you've always done. They brought to us apprenticeships. Columbine Health Systems has brought skillful techniques and processes into how we now hire. We're starting our second apprenticeship cohort in a few weeks. I've met with. One of our apprenticeship events was somebody from Boulder County, which is, the next county over, and in the town I grew up in, and I have his information as a contact more about apprenticeships. I wouldn't have gotten any of that information had I not been part of that group. And we are, as a sector partnership, really pushing this apprenticeship model out there and trying to help people with it, but my own business benefited from that, right? And so it's, and when you have that many businesses there, then you can bring up speakers from Denver who wouldn't normally come for just a few of us, but will come, like I said, they have to leave probably at 5:30 in the morning to get up here to present to us because we have enough volume and enough capacity to take on these things and launch them in northern Colorado. So, and I was at an event with the governor's office last summer, and I had a couple people come up, and I don't know, big wigs in the workforce system in Colorado, and they said, boy, we heard Northern Colorado's got it going on. Well, yay. I said, well, of course, what else did you think is happening? But, if that governor's office, if they think that's happening, think of the power that we have when we call and say we need help.
Yvonne, part of what I'm hearing here also is that word spreads, but also there are these little nuggets of success, like the governor turning to you, being known and gaining traction across the state. The example about Coach Bob, and that all of those little pieces are also evidence of success of the partnership and the impact that it's having on your community.
For sure. And we were just involved in the city of Fort Collins has been funding and supporting clusters. That's what it started with, that language. And then then sector partnerships came in. So they had the water cluster, the energy cluster, and so then they've kind of done clusters and sectors together, and, they're wondering whether they should continue to support those, what money should they give, what's the best next steps, and they've interviewed our sector partnership, and what I hear from the city leaders is, we really don't want to stop funding what you're doing. We're struggling to figure out how we should support the water cluster. And so, we are part of their report that they made and their consultants that they have around how they can continue supporting the work that we're doing. And to Lynne's point about the behavioral health, for 3 different voting cycles, we tried to as a community, support a behavioral health center and program in our community, and building new and a tax, program to pay for all of that. And the first 2 times it didn't pass. And the second time it passed in Fort Collins, but not in our neighbor city of Loveland, that's in our county. And they told us point blank, we are giving you money as a sector partnership because of your behavioral health work, because we have to let the community know this is an important effort. There's lots of behavioral health needs in our community, and the work that you're doing is supporting our effort to try to get this behavioral health center built. And we were a strategic partner in that effort, and really never pulled together that's the connection they saw of us, why they were supporting what we were doing. So.
That's powerful, and nothing like showing success more than being a net attractor for resources and funds.
Yep, exactly.
So I'd love to turn to the group here. We've had a good introduction conversation here around the role of business leaders, but also what the partnership is up to in Northern Colorado. I'd love to hear from folks what questions you have, what questions you have for Yvonne on things that she's talked about so far, or otherwise. So I'll dive in here and prompt some questions, but would love to hear from folks if you have questions and things pop out throughout this conversation. So Yvonne, we've talked a lot about, through this series of 5 webinars, the importance of having business organizations and from one industry identify the priorities for sector partnerships and really take the reins in owning these partnerships and move them forward. One of the big questions that we've received, as you could see in the beginning of the webinar here, also is just around how do you really attract businesses to be a part of this conversation and to be a part of these partnerships. And so in one way to answer that question, Yvonne, I'd love to hear directly from you around why this matters to you as a healthcare organization and why you participate in this partnership, as a way to really spark thought about how the partners that are on the line can frame up why this matters when they're recruiting businesses to participate in partnerships.
Sure. And I think when I was going around and helping to recruit as well, I drew 2 circles and then, had them over each other, right? And so that you have that middle section, sorry, I have a grease pencil board, but where the circles cross over each other. And I would say, the sector partnership isn't going to reveal all the things about what you're doing. You're not going to share all your data or your contracts or anything else. But what are the things that we have in common that we can work on together that would make a big difference? And people seem to understand that concept, right? That we're not going to take the whole circle, but where we cross over as healthcare providers. I think I also use the notion that unless we come together, we're just fighting each other. And I think for me in healthcare, and I know you all represent all different sorts of sectors, but in healthcare, it's personal. And when our 2 hospitals were, surging and, going to develop their footprint in our area, I had people say to me, if I call 911, where will the ambulance take me? You know, and so the citizens themselves were a little bit worried about what the sector is doing, right? And inadvertently, we don't mean to do that, but when we're marketing our own, we really don't show what our sector is about, if that makes sense. And so I talked about that with people, and everyone was like, they seem to resonate with that. Like, right, we all live here, we're providers here, we care about our community, and we want our business to thrive, but we recognize that it won't unless we do some of these things together. You know, that's probably why it matters. Why I continue to participate is I wouldn't have the opportunity. I have no way to just, I suppose I could call up the city manager, Roy Otto. I don't know how long it would take to get on his schedule or get on his appointment. I feel like I know people in the workforce system well. I know people in our state government well that I wouldn't have known or met before. And the relationships, I mean, Lynn and I have worked together for a long time, but I'll tell you, our relationship is so tight. If something is not going well, we can call each other and say, what the hell? You know, what's going on here? Because at the end of the day, the best work is because we know each other well, right? And so these deeper, tighter connections, when we decided last year that we needed to, well, our Colorado Workforce Development Council said you can no longer count your in-kind donations as the match for the funds we're giving you. You need to generate your own funds. We're like, okay, yay. We've been around 5 years. It made sense. So I reached out to one of the CEOs of UC Health here, the CEO, and when I asked him for $5,000, he said, I thought you were going to ask me for 50. And I thought, shoot, I should ask for at least 10. And it was nothing. In 3 days, I had $25,000. And I called everybody and said, we need $5,000 from you, because they see the value of what we're doing and that connectedness of that. But I've not produced an annual report. I didn't come up with data. I mean, we are now doing an annual report because we've now taken your money. So we feel like we have to then go back and say, this is what your money has provided to us. But for me to get that money, we didn't have to do that, because they saw the importance is getting us all together, and the next big thing that comes on, the next opportunity, we are organized and ready to go, right? We can in a moment's notice say, all right, sector partnership people, here's our list. We are going to call an emergency meeting. We have this thing that's going on. We need you to come, and we have 150 names of people that we could get to that. So it's that for sure. And when I meet the new, you know, I just bought the new home health in town, or I'm the new director of the home health agency, and then they come and meet, you know, how can we partner with Columbine, blah, blah, blah. And then I say, do you know about the sector partnership? This is where you need to be. This is one of the places where you need to be. And I make sure they get on the list, and I make sure they get going, because it's strength in numbers, and they meet people, and their connections grow, and oh no, it all just works. And I think we've also taken the philosophy that play and participate at whatever level makes sense for you. You may come to the apprenticeship 90-minute conversation only because that's the only thing you wanted to hear about. We may not see you for a whole year. That's just fine. You may only be on the workforce committee. You may be on the workforce committee once the MA thing is set up. We don't put any membership guidelines or attendance or whatever. We do spend time going, well, who's not here? Who should be here? Who are the main providers? In our area, Kaiser had some pretty big cuts of staff, and we said, all right, we've lost a Kaiser representative. Who's going to be that Kaiser rep? And we made calls and said, you have to be at this table. We need you to be here. And one of our hospitals sort of slipping off in attendance, and I went back to the CEO and said, no, you got to get people back in here, and they come back. And the Kaiser representative who lost his job then took a job with someone else. First thing he did, come back to the partnership. So did that answer?
That does, yes. That's super helpful, Yvonne. And I think that really the power of building relationships and trust. I often say that sector partnerships are about 99% building relationships, and your answer really highlights that this is all about relationships and trust in your community. And as a result, you've been able to become this go-to spot for the community, and also a net attractor for funds and making things happen. So thank you.
Yeah, we hope so. And I think, all of us that are on the planet are here because we want to make a difference, right, in people's lives. And our collective good can do that, right, our collectiveness. Otherwise, we're just on this treadmill singly trying to get this done. And I would think for public partners, having these one-off meetings all the time. I mean, our meeting on the 28th around high school apprenticeships in healthcare has been driven by the Workforce Center. They're like, we can't get this going. We can't get any traction with the healthcare community, but we know this is happening in Denver. Can we bring this? And we're like, you bet. This is driven by their side of the equation. And it's like, you bet, come on over here. And of course, I think we should have high school kids there because I think you ought to pick what you want to do and go to college and be done in 4 years. But, that's, being wise and spending that money. My daughter's in college, so I'm highly motivated about that. But, that's again, something that is missing within our community to make sure that the healthcare businesses are stepping up and helping young people figure out careers. And we're helping to push that whole message and mission about that. And then, we can keep track of then how many internships we did get, how many healthcare organizations did step up and say, I will take somebody under the age of 18. What does all that mean? One of our apprenticeship meetings, somebody said, well, how can you have 17-year-old apprentices? Aren't you worried about HIPAA violations? And I said, oh, heavens, I have 50-year-old nurses who violate HIPAA every day. So HIPAA isn't an age thing. It's a culture and a training, right? So we're trying to break down those stereotypes. So, okay.
So I'm curious if Emily, Lynn, or Yvonne, if you have any other examples where knowing that these are people within the community, not just maybe a workforce, that might be the primary driver to bring them together is workforce. But if you have any other examples where other issues rose to the top around like community development or talent attraction to our area or community, and what that might have looked like. I mean, is it things like, oh, as a group, we started the conversation to open a dog park or free movie Fridays or, just like things that kind of surprised you that came up that meant a lot to your members?
It's a great question, Joe. I'll chime in there with a few examples. And I think actually the example that you provided up front, Yvonne, around PassR is one that I like. And honestly, this partnership, and Yvonne and Lynn chime in here, but when this partnership initially launched, there was no focus on workforce development up front in their original set of priorities in the Northern Colorado Healthcare Partnership. And so I think that's a good example of how things like PassR, and so sure, there was this collective power of numbers that helped shift how PassR was being approached across the state. And has resulted in them being a real leader in this field in the region. But it also helped them get that early feather in their cap and to build up momentum to tackle the harder things like the MA challenge that they're having. And so I think the timeline in this partnership is helpful to understanding how early wins that aren't workforce can help really build traction for bigger things down the line and for workforce. Because at the end of the day, I mean, let's face it, workforce is the big gorilla in the room and also very, very tough to tackle. And so it's complicated and complex. A few other examples that I like, the Eugene, Oregon, in Eugene, Oregon, a tech partnership early on identified that what they really needed to grow as a tech community in their region was a direct flight to California. And so they worked early on to, again, rally the numbers of tech companies in their region, did a letter writing campaign to the airline, held some conversations with airlines in the area and the airport authorities, and resulted in the direct flight that they were looking for. There are lots of great examples around business to business networking. And I think some of the examples of success early on that helped build that the relationships and the trust across businesses are things like in central Pennsylvania, a manufacturing partnership. When they first launched, there was a conversation at the launch meeting just around shifting the culture in the workplace and the need to do that in manufacturing across the region. And one of the manufacturers shared You know, what we've found is just changing lights and starting off with changing the lights in your facility as a low-cost way to begin shifting the mood of the facility can make a big difference. 2 months later, the partnership met again, and I overheard them sharing with one another informally that, like, hey, I switched lights and this is really making a big difference. My employees are noting it. And so there are lots of examples out there where priorities aren't focused on workforce up front, but also the power of priorities around building momentum and generating quick wins and in the relationships with one another.
Well, and I would also,
yeah,
I would say, I think, I can't remember which one of the meetings somebody brought up how important it is to keep inviting your public servants and your legislators to the meetings and your mayors, to keep them up to date with what you're doing, because no matter what it is, when it comes down to coming together, we have a legislative discussion at least once a year, and have the different facilities just talk about what's going on in the legislature to impact healthcare and what this group can do either as a group or individually to impact laws that are being made around healthcare. So I think also keeping apprised of all that is really important, and this group can help do that.
Thanks, Lynn. So I'm going to move us forward here and just really quickly, as we're talking about sustainability overall and how to keep partnerships going, and recognizing that many of you have partnerships that have been around for some time. There is a really handy self-assessment tool around sustainability and to help you troubleshoot and tap into where you might want to put energy and effort online. And so you can find the self-assessment tool on the link on the website that's up on the screen right now, and we'll send this out after the webinar as well. As you move into sustainability, this is an overall checklist that is helpful to keep in mind. And so as you're moving to sustainability, and this is a constant, sustainability isn't something that you move into and then you're on an upward trajectory. It's something that you need to constantly nurture and care for and pay attention to. And so things like having agreements around the organizational home or just the overall organization for the partnership, keeping businesses in the driver's seat, ensuring that the regional team of partners are really committed to one another, to the model really specifically, and very specifically having businesses in the driver's seat, and that they're committed to the businesses is really important. And we've heard throughout the conversation today and examples that Yvonne's provided about how the partnership has become that go-to spot for working with the industry in the region. And so not forgetting that you have that. And the reason that Yvonne and the NOCO Healthcare Partnership has gotten to that point is that both partners and businesses have been really committed to using the partnership as that go-to spot for working with the healthcare industry across the region. Continuing to attract new business leaders and deepen the commitment of the business leaders you do have is critically important. Thinking about leveraging funding and other initiatives that really position the partnership as the big tent or the go-to spot for working together. And so Yvonne, you've provided some really excellent examples of leveraging funding and also just becoming that net attractor for funding across the region as the big tent. And then finally having a process for continuous improvement and continuing to evolve the partnership overall. And I will say on this, the process for continuous improvement, that sounds very wonky and bureaucratic in some ways. And I think, Yvonne, what you have helped us understand throughout this conversation is that this also can be an informal process for continuing to evolve and to take advantage of opportunities that are presented to you as a partnership, and knitting them into your plan for moving forward.
Oh, absolutely. The Northern Colorado Manufacturing Partnership and Health sector partnership launched at the same time, and Lynn's across both of them. Our workforce folks are across both, and so we're like cousins, I would say. And they very formalized very early and had their protocols and their meetings and a structure, a very written up structure. And we had a structure, we just didn't write it up. We didn't write bylaws till last fall. And even then, it took us a while to go, are we going to write them up? And I think that's because we're so dang highly regulated in healthcare. We're all like, oh. But we felt like we were at a place where we needed to have some more formal structure. And as new people are joining in leadership, and as we're transitioning, some of us who've been around, who want to continue to be there but not in the leadership roles, we needed to help create that structure. So it comes when it needs to, but don't put the structure ahead of the people that you want there to help guide that structure.
Yvonne, there are two things I want to highlight in what you just said. So number one, that there is no one blueprint for how this works across partnerships. And so every partnership will look different. And then number two, that you, Yvonne Meyers, and your colleagues in the healthcare industry are the ones that have determined what this looks like and what the partnership looks like moving forward. It's not something that the public partners or the intermediaries, as they're called sometimes, have put in front of you. It's something that really is grown from you as business leaders. So I think those two things are really critically important. No two partnerships are alike, and businesses are the ones that are making the calls here. So with that, I'm going to put up here some myths around engaging business leaders. And so these myths are things that, as I do work across the country, are things that I hear commonly, that business leaders are so busy, I need to just make a really specific request of them or tell them about our program so to make it easier for them. And I also don't want to ask them for too much time. I also hear sometimes, well, how do you get employers in the room and get them focused on things that are positive? They're just always coming to me and complaining. So I'd love to just have you all, the participants that are on the phone, take a look at these myths for engaging businesses, or around engaging businesses, and see what stands out to you. Do they resonate with you? Are they things that you have experienced in the past? And then and also, what questions do these myths spark for you around engaging businesses? So folks in Iowa, do these myths spark any questions for you? What stands out in looking at these myths?
This is Christy in West Iowa Manufacturing Sector Partnership. That third one, employers know their skill needs. We just need to ask them what they are. What? Can you expand on that one a little bit?
Yes, I can expand on that. And so I often hear that in working with employers and partnerships across the country, that we as workforce development or community colleges have a perception that all employers and businesses know exactly what the skills are that they need up front, and they can just respond to a survey and fill out the skills that they need. In reality, I find that the situation is much more complex than that. And so it takes more than just getting a list of skills to really appropriately scale and respond to meet the complexity of the skill needs and of the workforce needs that individuals have. I also often find that it's not just about skill needs, that as employers are working to grow their workforce, it's about certain attributes of individuals and the whole picture of the individual. And I'd love for Yvonne and Lynne, for you also to comment on this. I
have a good example around that. I think for years, all of us who have been in this business for a while with community colleges or in education, hear employers talk about soft skills. And, you know, if you could just get them to show up, and if they would just show up on time, and we can teach them the technical skills, but we need the soft skills. If they just had better customer service, if they could just work better in teams. We all heard that all the time, and I don't know that we really understood how to teach that to students. We kind of, at the beginning, I think many of us were like, well, if they're not taught that at home, how can we even make a difference? So we started trying to look at ways to bring that into the curriculum. I know a lot of you have done this. We had a curriculum designer in our machining program write in team building activities, right? Because team was a part of it. And it was actually an instructor that came into the room and said, this is a waste of time. These students need to be on the machines, and we're having a team activity around being on a desert island and what do you need to be able to survive. And these students had no idea what the relevancy was to machining. So we brought in manufacturers who helped us rewrite, and now that machining program looks like it does when those students go to work. They're required to wear uniforms, they wear name tags. If they're going to be 10 minutes late, they call in to their instructor. There are points taken off all the way through their semester based on those things. The team activity is, and I may have talked about this before, but the team activity is actually a hammer with 3 different pieces, and those students all have a different piece that they have to learn to machine. So I think it's really important for us in education when we're talking about the skills that employees need. It really helps to have those who do those skills every single day come in and help you understand what they're about.
When you started talking at the beginning, I thought you were directly quoting people from our sector partnership. Yeah, thank you. That helped expand on that. So they know what they're missing, but they don't quite know how to get there. So it sounds like it's a conversation and a trial and error over time to fill that skill need.
And I think bringing in those experts who do the job and really getting at what does it take. We brought in actual people. When you start building that curriculum or start looking at how you build those skills, bringing the people in who actually do the work is just invaluable.
Okay, thank you.
I think I've heard Paul Harder say, Lynn, from the manufacturing, that the employees that they asked for to help with this curriculum were those shining star employees that the business would love to have 40 more of, who were the best examples of a good employee, and those were the ones that helped with that curriculum. So it's a great partnership between education and business.
Yvonne, I'd love to hear your advice that you'd give to partners who are out there working with businesses and they're continually coming up against a response of, I don't have enough time.
Well, I think, and I was just with Lynn a few weeks ago in Cheyenne, Wyoming with that launch, and we spent some time, they launched a year ago, and then we spent some time, and people have gone through, I saw your next slide that says, businesses come and then the interest kind of wanes, and then they, are they going to come back? And we don't have this person at the meeting, we don't have this person at the meeting, they came and now they haven't been back. And, we didn't spend much time worrying about all of that. We were like, people are going to join us when they want. We want people who want to move this forward. We want people who are going to get it. And some people came and we didn't see them for a while, and then come back, and some people have taken leadership roles that didn't do anything the first couple of years with what we're doing. And so, if you're doing what they want, they will schedule you. They will put you in. If you're doing what they need to have, we announced the apprenticeship quarterly meeting, and we had over 100 people at that event. And I mean, good questions and engaged individuals. And then we felt like the next conversation should be opioid and your employee. They're in healthcare because we're so busy caring for the opioid crisis. What about our own employees? And we only had about 48. So our takeaway is, well, that's not really what a lot of people, as many people are interested in. It's about that workforce. And so, you know, we're always evaluating too, what are those things that are what they want to hear and what they need to know, and where their pinch points are. And for them, the pinch points are now employees and workforce and employers sort of stuff. So I don't think you have to, don't create your measure, public folks, of who didn't come. Hang on to the people who are coming, go with them, and everybody will start coming. And if they're never going to come, well, then they're missing out. Too damn bad. Don't worry about it.
Go where there's energy. And Yvonne, the Margaret Mead quote comes to mind around the small group of committed people really being what can spur change and all that's needed to spur change. So
exactly.
Go with where there's momentum and energy and interest. Although I know, I will say that's easier said than done, and I know that it can be discouraging if you're out there talking with folks and you're coming up short. But I do think there is an important piece of finding the right people to ask. So finding those, we've talked about the importance of having decision makers in the room that can bring a whole organization with them, and the weight of the organization with them. We've also talked about finding people that are positive sum and collaborative. So you want people that are interested in making a collective dent. You also want people that generally show passion for their community and their region. And so finding those types of people can be really infectious and also attracting other businesses to the partnership. And ultimately, I will say the business to business ask, it has been critical. If Lynne by herself were out there trying to drum up support for the NOCO healthcare partnership, it would have looked much different than it did. And you heard early on Yvonne talking about how she really personally took it upon herself to get out there, knock on doors, pick up the phone, call people, and get them engaged in this project. And so I think that's also really critical. Finding a few key champions to really help recruit and attract and get others involved.
And Emily, I would add, you kind of fake it till you make it. And I know that doesn't sound good. But, we had a website, so we tell people we have a website. Woo! And if you have a website, you're something. And then I remember we felt like we should have some sort of a banner when we're at, career fairs, or when we're at the health sector summit that happens in our area. So I think Columbine donated a $250 banner. So we had a banner. And then when we got an assistant, we pay for, we share with the manufacturing sector a wonderful employee that we pay that is our administrative assistant. And at first we were donating that time individually, and now we pay for that. And we got name badges. So when you show up, you have a lanyard with a plastic in your name, and all your names are out on the table. My God, we look like something, right? And so sometimes you are waxing and waning. And I will tell you, there were times at meetings where everyone's like, I don't know, is this going to go? And I'd be like, you bet it's going to go. And I'd get in my car and think, holy God, is it going to go, right? And you just keep going forward. Think of climbing a 14er here in Colorado, and all you do is think left, right, and pretty soon people are joining you, and everybody's getting to the top of that mountain, and you don't know how it happened, but just keep going forward. Don't judge it too much. Just keep pushing it forward.
One foot in front of another, and just moving through where you do have small hiccups along the way. We're about out, Joe. I'm going to turn it back to you here in just a few minutes. So if folks do have questions, please chime in here over the voice on the computer or phone, or also on the group chat. Yvonne, there is one other thing that I want to bring up here as a topic before we turn it over to Joe. And that is around these sustainability pitfalls. And so you can see the the bulleted list of sustainability pitfalls. Folks, do chime in here if you have questions about any of these pitfalls or if it would be helpful to dive into any of them specifically. The one I want to hone in on upfront is just the over-reliance, the last one on the page, over-reliance on community colleges, workforce boards, or any one organization as that kind of codified convener of a sector partnership or next-gen sector partnership. And so essentially what we mean by this is that it is a real pitfall if the sector partnership is a workforce development board thing. It is a real pitfall if a sector partnership is the thing or the partnership of one community college. And Yvonne, I'd love to turn it to you to just your reflections on this overall, especially given that you have in the past served on the workforce board for Larimer County and in a variety of different boards across your community. And I'm curious about how this is different, how your sector partnership is different, but then also why it's important for this not to just be the thing of one entity.
For sure, I'd love to speak about that. So like you referenced, I was on the Larimer County Workforce Investment Board for 8 years, I think. I chaired it for maybe 2 or 3 of those. I was on external advisory boards for the nursing program at Front Range, for the nursing program at the University of Northern Colorado. And, you know, at those external advisory boards, you know, you come twice a year for an hour and a half. They give you donuts or cookies or sandwiches, depending on the time. And they tell you what they're doing. They ask a few questions. We give some feedback. We say, well, we don't like that. We don't like that. And they smile and go, eat another cookie, and then they can go about their business. And so, you know, there was not, and that structure doesn't allow time for change, and it doesn't create a relationship, right? So we meet and we all smile and we eat the donuts and we put it on a resume. We feel pretty good about it, but nothing really changed. And with the Workforce Investment Board, there was a lot of things brought down. The Department of Labor from the feds brings it to the state. The state's going to do it. We would go to Denver. We would go to Vail. We'd go to other places. And you know, as a representative, the business community would go to these events and, oh, rah, 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 we're going to launch the ACE program. We're going to launch this new thing. We're going to, whatever it was. And, you know, as a business person, you're like, okay, I wonder how are we going to do this? How's this going to impact me? How am I going to do it just as my own little business? And then you get back to work the next day and you just go back to work. And then it's sort of, you know, pushed down upon you, and you're like, well, I don't know the benefit of this, and this isn't really where my issue is. And right now, what I'm working on in my business, I don't have time for that thing. You wish you would have done that 2 years ago, or maybe 2 years from now I'm ready for that. And the very first, within 2 hours of our sector conversation launch that day in Denver, when they said this is business-led and businesses will say what they need, I was like, I am fully in. Best example I can give you is when Lynne and I had multiple conversations over the years around IT people in healthcare, and we have one of our employees in IT, he doesn't speak. Like, you even say hello and he just looks at you. They're just not communicative. And that's just the nature, and I don't mean to stereotype, but that's the nature of it. They're just super brainiacs with the computer and they're not going to visit. Well, they're then communicating with our nurses who want a lot of conversation about their computer and what's happening. And I said, we should be training people for IT and healthcare. And we were having these conversations. And then stimulus money came. So our other community college in town developed the curriculum, trained students in healthcare IT, and then they come back to us and they say, we didn't even know they did the program. We didn't even know anything about it till they came to us and said, we need you to take these students as interns. And we're like, what is this program and what's the curriculum? And that's not what we needed. And then the communication was, well, healthcare isn't supporting this program that we did. And we're like, well, we would have. If you'd have talked to us first, if we'd have had the conversation, if we'd have partnered together, we might have even given you some money or some IT space or done some shadowing, or, you know, you just never know. We have a 17 computer IT lab here. We would have maybe offered that, you know, if we'd have known about it. So this model is really business out front. They will engage, they will offer things to you, and at the end of the day, you will get all the things done that you need to do. You'll be able to meet all your own metrics, and you will look so awesome and cool. You'll go federally to the Department of Labor, and they'll give you awards.
Thank you, Yvonne. So a few things that you hit on throughout here is that just making the time, a key difference being that it makes the time for the relationships and for you all to look at one another as healthcare leaders and identify those common opportunities and challenges that you're facing. And then that over time, you've really, your relationships have grown and now you trust one another. And so it also gets to some of the other sustainability pitfalls that we have up on the screen around a pitfall being presenting programs and solutions to business leaders. And so what your answer really shows is that you need to allow for time for businesses to identify those opportunities for working together, and also time for them to play out. And in that it is a very different model and approach than a workforce board or community college. One final thing that I'll hit on related to why this isn't just about one entity convening these partnerships is that your partners in community colleges or workforce boards or other nonprofit organizations in your communities also have relationships with business leaders. And so they become a really critical strategy and individual to help you attract other business leaders to the partnership. They also have different programs than each of you have. And so they can offer different solutions and different opportunities than one entity can alone. And Yvonne, I think I come back to something you said earlier around if we're all just going down in our own silos together, we can only make so much of a change. But collectively, by pulling together the resources that we all have, the change and impact is much greater and also much longer lasting. And so that gets to why it's so important to have a diversity of public partners in the room and really committed to working together to support partnerships. So with that, this has been just a tremendous conversation here today. I'm going to wrap it up and turn it back over to Joe. But want to just quickly show these indicators of successful next generation sector partnerships. Again, this is just a summary slide that we have looked at, I think, in every webinar we've had, but by choice and very intentionally, because these are things you want to make sure that you're moving towards for long-term partnerships. I also just want to make a plug for the next generation of sector partnerships community of practice. You can sign up here on the website for our newsletter. So do sign up and get tapped into the ongoing webinars, office hours with Next Gen experts, as well as an annual academy that will be taking place this winter. We're working carefully to identify the exact location and date for that, but Joe and others will be in touch. There are opportunities and to build a team of workforce education and economic development partners at the state level or regionally. And so the most powerful way to attend that academy is bring in a team of partners and business leaders from your region to participate. So I would love to hear from you all and continue the conversation with you all through the Next Gen Sector Partnership Community of Practice. So don't forget to go to the website and sign up for the newsletter for regular updates. And with that, it's been a tremendous pleasure to really be with you all over the last 5 weeks. So don't hesitate to reach out to me personally as well, to Yvonne and Lynne. I'd also just love to thank Lynne and Yvonne very much for their time today, and also throughout the series and just the tremendous insights. I always learn about new examples as well. So thank you, Yvonne and Lynne. And thank you to all of you, the participants, for really staying engaged over these last 5 weeks. Joe, with that, I'm going to turn it to you.
Yeah, absolutely. And yeah, thank you, Emily and team. It's flown by, time flies when you're having fun. So I know we've gained a lot of information and knowledge from these webinars. As I had mentioned, the recordings are posted on our website that's on the screen here. as well as YouTube. I wanted to give just another quick shout out. I know Emily had just mentioned it, but I would strongly recommend going to the Next Gen Sector Partnership site to take a look at the toolkit. There are a number of free resources available that dive deeper into a lot of the topics that came up during these conversations, and we maybe didn't have time to get into as thoroughly as we maybe had wanted. Like Emily had mentioned, they also have an academy every year, and I've attended them over the last couple of years. So as one of our next steps, I'll be sending out information as we learn more about the academy, about potentially putting together an Iowa team. And at that academy, you'll hear from people like Yvonne and Emily about certain topics, but you'll also have direct access to a consultant that can help us with Iowa issues specifically. So really excited about the interest that we're getting from these webinars and maybe fielding a team at the event this year, generally in February. So just as an idea of time frame. I would also recommend joining for those community of practice webinars that they have. So it will be topic-based, it's free to join, as well as the open office hours where it might even be Emily or Lynn, where you can just ask direct questions to them, similar to a professor might have open virtual office hours. So very, very beneficial, and again, pleased that it's free to anybody and everybody. A couple of quick announcements, and I know I've mentioned them on previous webinars, but the sector partnership model, and a lot of what I do at the Department of Education to promote sector partnerships, is in direct support of the Future Ready Iowa initiative, which is the statewide goal of having 70% of our workforce attain education and training above high school by the year 2025. So we're heading down that path. And these community collaborations, these sector partnerships, these business community boards are critical to getting to that goal. It's an all hands on deck approach. So I'd recommend going to futurereadyoiowa.gov to learn about some of the other recommendations and strategies that are getting us to that point, such as scholarships, employer funding, lots of funding out there available to get us to that goal. They also have opened up a series of employer summits that begin in September and run through November that I would recommend you check out on the futurereadyoiowa.gov site. To sign up, there's around 20, if not 30, around the state, so I'd be surprised if there wasn't one in your community that I'd recommend you sign up, and definitely direct your business or your employer members to join so that their industry is represented, but also can be able to speak to the work that you're doing as a group within the community as one of those solutions or those strategies to try to get more employers involved. I'd also recommend checking out the Clearinghouse, so clearinghouse.futurereadyoiowa.gov to post projects for students around the state to be able to log in and take access to learn about different industries regardless of location. In the comment box, I'd referenced the intermediary network, the Iowa Intermediary Network that Allie had mentioned early on in our conversation today. They just launched a new website at www.iowain.org. That's a really, really great resource that's available in your community. I'd recommend checking out to build work-based learning opportunities and to leverage employer and educator experiences and relationships that are already built. So instead of going back to the drawing board, I would reach out to them as a first step when we're talking about better engagement with our school population and work-based learning. I've been working directly with their team on a number of areas. Specifically, we just launched or just released a healthcare work-based learning toolkit. So similar to what you've seen from the Next Gen team about sector partnerships, we're developing a series of toolkits that talk specifically about work-based learning in different industries. We just launched healthcare, but health science being the larger industry, 2 weeks ago, and that's on our website if you want to take a look. We're currently working on one for manufacturing. So what are some specific considerations to the manufacturing industry in Iowa when it comes to work-based learning for safety, labor laws, privacy issues, that sort of thing, to again try to supplement your work as sector partnerships, knowing that this comes up a lot in the conversation. I want to have more students involved, but I'm concerned about issues or laws or regulations and safety. Well, these toolkits are meant to have that conversation and start providing examples and considerations for that industry across the state. Another aspect that we try to support sector partnerships with through the Department of Education is a series of toolkits, or not toolkits, but career pathways documentation. So we've done them in manufacturing, health science, energy, and IT. We're just getting ready to release, hopefully by the end of this week, if not early next week, one in the building trades. So architecture, construction, engineering. And those are available on our website. I recommend checking out. to again help, like I mentioned, supplement some of the work that you're maybe conducting with your local employer groups. It could maybe be a starting point that the state has developed career pathways within our industry. Let's review those as a group and then maybe localize them and customize them to meet our needs, as well as that work-based learning toolkit series. And then last but not least, I know I've mentioned before that I've been working with some of the community colleges across the state to, in terms of next steps. You know, what do we do with this now that we've had these webinars as kind of an introduction to the model? So there are still plans to do some sort of hands-on training. We might refer to them as sector partnership workshops around the state. But it looks like we're going to maybe move that further into 2020, maybe spring, to not interfere with the Future Ready Iowa Employer Summits. Knowing that you know, these are all rowing in the same direction of greater community collaboration, making sure that our employers know that we have these resources available, and how do we provide them a podium or a place to come to, a table, a shared table, to have that conversation and start making some difference in our communities. So stay tuned for more information on that. Definitely reach out to me before you see some of those emails or some of those announcements. But I'm happy to travel around the state or have a conversation with you directly about what this might mean for your community and how do we get some of these things off the ground in a more immediate time frame. So you have my contact information. If you don't, it's on sectorpartnerships.educateiowa.gov, and I'd be happy to help support you as much as I can with those efforts, either to build or plan for a new partnership, or to reboot or relaunch, or just support some of those expansion efforts that you might be running into. So I'll turn it back to Emily. You know, again, thank you for taking your time. This has been great. I think it's been very beneficial. I've had great feedback, Emily and Lynn. I really, really appreciate it, and look forward to working with you in the future.
Excellent, and thank you all, and look forward to hearing from you all in Iowa. It's been great to be with you these last 5 weeks. I think with that, we'll wrap it up. So thank you, everyone. We'll look forward to being in touch.
Absolutely, thank you.